الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Visceral leishmaniasis by Professor Mahmoud Hani Suleiman. Epidemiology. General description: a parasitic infection transmitted by sand flies. Occurs in two distinct forms, cutaneous and visceral leishmaniasis. Visceral type is a chronic systemic infectious disease caused by an intracellular protozoan that multiplies in visceral organs. Geography: among children in rural, tropical, and subtropical parts, Middle East, Central America, while it is sporadic in Europe in adults and children. Season: no seasonality. Causative agent: name Leishmania donovani, resistance outside body moderate. Source of infection: man or animal, rodents, dogs, other canines. Exit skin. Period of communicability: no man-to-man transmission, but man is infective to sand flies as long as parasite is circulating in blood. Host factors: homologous immunity after infection. Nota bene, cutaneous type does not give immunity to visceral type. Malnutrition predisposes to clinical disease and activation of inapparent infection. So malnutrition play a role. Mode of transmission: bite of infective female sand fly. Life cycle: flagellated forms develop and multiply in sand fly gut in 8 to 20 days, then injected during bite. In man, organism taken by macrophage transform into a mastigote, which multiply inside macrophage. Then cell rupture, enabling spread to other macrophage. This picture shows natural uncut forests are transmission sites for leishmaniasis. People who collect rubber, this is their occupation, so it is a work-related disease. People who collect rubber or clear such areas for agriculture are exposed to infection. This picture also shows a town where the environment can predispose to leishmania infection due to inadequate housing and lack of sanitation, so sandfly breed easily and transmit the disease. Leishmania, visceral leishmania. Portals of entry: skin through bite of female phlebotomous sandfly. Incubation period 2 to 4 months. Diagnosed first clinically. Symptoms and signs: fever, hepatosplenomegaly, lymphadenopathy, anemia with leukopenia, progressive weakness. Fever is gradual or sudden onset, with continued and irregular course, with 2 peaks per day, 2 peaks for the fever per day. It may be followed by dermal type. Case fatality is high. This picture shows 2 young boys experiencing visceral leishmaniasis with distended abdomens due to hepatosplenomegaly. Investigation: demonstration of Leishmania donovani bodies in stained smears taken from bone marrow, spleen, liver, lymph nodes, or blood. Prevention: general prevention, health promotion for healthy persons to raise non-specific resistance by environmental sanitation through destruction of stray dogs. Sand flies have a short flight range and highly controlled by residual insecticides. Fine screening of homes, eliminate breeding places like shallow water, destroy reservoir animals and their burrows. Health education, about wearing protective clothing in evenings, and about modes of transmission and preventive measures. Legislation of sanitary laws. Specific prevention, vaccine under trial, control to prevent spread from existing disease, case control, early case finding, notify, isolation from biting to avoid infection of sandfly, disinfection of environment close to patient, treatment, pentosome, 0.1 to 0.2 milli per kilogram per day intramuscularly or intravenously. Do not exceed 10 milli per dose. In India, 60 doses, elsewhere 30 doses are necessary to complete recovery. Case contact control, avoid exposure to biting, control of environment through vector control. Epidemic measures, environmental and vector control, early case finding, prompt treatment. ونقول الحمد لله رب العالمين و thank you for your good listening.